Are dental crowns a scam, or are they really necessary? This can be a legitimate thought because crowns can be expensive. For a filling or something like that, if you're paying out of pocket, it might be a few $100s or something like that, but for a dental crown, it could be well over $1,000 and probably more. Well, in this video, I'm going to go over a little bit about what a crown actually is, when it's actually necessary, and some signs to see if you're getting scammed or not. So in simple terms, a crown is like a dental cap that goes over one of your teeth. So when you do a crown, you have to prepare the tooth. And a preparation or a prep is when you basically remove some tooth structure 360 degrees around the tooth. And the goal here is to make enough room to have enough thickness for your crown. Now there's different materials for different crowns. Sometimes you can have a ceramic crown, sometimes you can have like a metal or like a gold crown. But regardless, you're basically turning that tooth into a smaller version of itself, or kind of like a stump. And then this crown is going to be cemented or bonded on top of that tooth. Now this is usually done when a tooth is weakened. So typically when you get a cavity or a hole inside of a tooth, you can just do a filling. Now a filling is just like it sounds, where you drill a hole in the tooth, remove the cavity, and you fill up that hole. But sometimes the cavity gets so big and it eats up so much of that healthy tooth structure. In this case, a filling would be really, really big. And sometimes a really, really big filling will not hold so well. And in this case, you have a higher chance for that filling to fail, for that filling to crack or break, or even for that tooth itself to break. The thought is that when more than 50% of the tooth structure between the cusps are those parts of the tooth that stick out, like your molars, when more than 50% of that width is compromised, then this is time to put a crown. Because the idea is at this point, once you do a bigger filling, then that whole tooth is getting compromised. And the idea is, yeah, that filling might hold for a little bit, but if that tooth does break, then it can break really unpredictably. And it might break below the gum line, it might break into the nerve inside the tooth, and in this case, it might take something more involved. It might require a root canal to get fixed, or it might not even be savable at all, and you might actually lose that tooth. Speaking of root canals, this is another reason where you're probably gonna need a crown. When you do a root canal on the tooth, you're removing the nerve and the blood supply inside of that tooth. Now, a root canal is done when the tooth is super painful and you have to get that nerve out of there, or there's an infection. So either way, you have to clean away that nerve and that blood supply inside of that tooth. But what happens is this tooth gets a lot more brittle because when there's no blood supply to it, then it's easier to break. Now again, instead of doing a bigger filling here to fill up that hole and finish up the root canal that way, this a lot of times is too risky because the tooth is at a much higher risk of breaking without that blood supply. So again, that filling might hold for a little bit, but then a weekend or a holiday might come and that tooth might just break. Now you spent all this money on a root canal and you might end up losing the tooth anyway. This is why in a lot of cases a crown is recommended after a root canal. And this isn't true for every case where you get a root canal, but I'm gonna let you talk to your dentist about what specific needs you have. Other times you might need a crown is if your tooth does in fact crack or break. So sometimes people will grind or clench their teeth, or they'll chew some ice cubes, or their tooth will just randomly crack one day. If this happens, like I said before, a tooth can crack really unpredictably. And depending on how a tooth actually cracks or breaks, it might not be fixable with just a filling. It might need something to protect the whole tooth. And sometimes people also get crowns on their front teeth. Now this could be like a cosmetic thing. Like sometimes people want veneers or teeth whitening or Invisalign, or they just want crowns on all their teeth to make them look really white and straight. But sometimes people get into an accident or they get cavities on their front teeth and then they get these bigger fillings. Now the problem with the front teeth, like those teeth that you see when you smile in those Christmas photos, is that fillings here don't really hold so well, especially when they're bigger. And there's a few reasons for that. The first is the front of the mouth is a lot more vulnerable to things compared to the back of the mouth. So if you're walking into trees, or if you're a very clumsy person and you hit your teeth with something, or if you're eating and you hit your fork with your teeth, it's usually the front teeth that will get affected. But also these teeth were not meant to take a whole lot of force. So your back molars are the teeth that are meant to be chewing food a lot. Your front teeth weren't really meant to be doing that. So if you're biting into things a lot with your front teeth, those fillings will have an easier time of breaking. And the last reason that bigger fillings do not really work with your front teeth is there's just not much surface area for those fillings to attach to. So let's say that you have a filling on your back tooth, like your back molar. That filling will have a lot of walls to attach or bond onto to stick in that tooth. But if we move on to your front tooth and half your tooth is broken off and you try to just do like a bonding or a big filling on it, there's not much healthy tooth structure that filling is glued to or bonded to. So that can make it a lot easier to break off as well. So in these cases, people might opt for crowns on their front teeth just so they have something to hold on to the tooth and they don't have to keep getting new fillings every so often. So you can see that crowns are not just a cosmetic thing, and they aren't a scam because the whole purpose of them is to preserve and protect the tooth so that you can keep that tooth as long as possible. Now I know what you're thinking. How can a filling be so much cheaper or a little bit more reasonable with its pricing, but a crown is so expensive? Well, the issue really comes with the lab fees and also the amount of time that they take. So typically for a dental crown, they take 2 visits. The first visit is the preparation, where I talked about before, where they kind of make that tooth into a smaller version of itself. And then they'll give you a temporary crown, so you have a tooth there. And then the second visit is where they remove that temporary crown and deliver that permanent crown. More visits means more chair time. Now, a dental business is still a business at the end of the day. Their goal is to make money, but hopefully they're not trying to scam you. When you have more chair time, it means more time that the dentist has to pay the rest of the staff and also pay money to keep the lights on. Now, the second reason they can be pricey is because of lab fees. When a dentist preps your tooth for a crown, they'll either scan that tooth or take an impression and send that to a lab. And that lab will design your crown in whatever material that dentist or you and your dentist come up with. And that's gonna cost some money. So that means that no matter what, that dentist has to pay off that lab so they can get your crown to deliver for you. Now, the third thing I wanted to mention was insurance. So a lot of times people have dental insurance and they think that everything should be covered at 100% or something like that. But I have a couple gripes with insurance. The first is insurance companies have a really, really low maximum a lot of the time. So for example, sometimes people have a maximum of $1,000 in their dental insurance that they can use. They're paying all this money every single month, but for the whole year, they're only allowed to use $1,000 towards their teeth. Now, if someone comes to me and they haven't been to the dentist in many years and they have cavities on pretty much every single tooth, even if they don't need crowns, even if they just need like basic fillings on every single tooth, they're gonna quickly eat into that insurance maximum and not be able to save every single tooth with just their insurance. That means that if they wanted to save all their teeth right away for a majority of their treatment, they'll have to pay out of pocket completely. Now, if someone comes in and needs a dental crown, then most likely that crown alone is gonna eat up all of their insurance. But most people need more treatment at a single time. Like a lot of times people need a root canal and then a crown. So in that case, the root canal itself would probably eat into all of their insurance, and then they're gonna need to pay for the crown out of pocket. Or a lot of times people need fillings and then a crown. And then again, those fillings might eat into a majority of their insurance, and then again, they have to pay for that crown out of pocket. So just because you have insurance, it doesn't mean that you're golden and you're not gonna have to pay more money for this crown. And speaking of insurance, they will do their best job that they can to avoid paying for anything, including your crown. Insurance companies always tell us that even if they say they're gonna pay for someone's treatment, it doesn't actually guarantee they're actually gonna do it. I know it sounds so crazy, but they get away with it. Now, with all that being said, does that mean that dental crowns are never gonna be a scam? Well, unfortunately, I can't say that with 100% certainty because there probably are some bad doctors out there. There's probably some bad dentists that will try to charge you more or upsell you to make more money. That's the reality that we live in. It's not just in dentistry, it happens in pretty much every single field. I will say though that I think the majority of people out there are gonna be more moral in their decisions on how to actually treat you. I think that the majority of dentists out there will try to keep your best interests in their mind. And part of the reason I think this is I just don't think it's sustainable to practice long-term but not keep your patient's best interests in mind. I just feel like at some point you're gonna burn out or something like that. And also the second reason I say this is just because the majority of the dentists I've met are pretty moral and honest. Again, that doesn't mean that you're not getting scammed. So I'd still recommend getting a second opinion or something like that if you're concerned. I do wanna address one other point though is some people will try to go to a different country and get a lot of dentistry done there because it tends to be a lot cheaper. But I will say if you're gonna do this, be extremely, extremely careful and just make sure you go to a trusting clinic. Because in the US, we have our US standards, so I can speak on behalf of America. But I'm not saying anything bad about other countries and how they practice, but I have seen some very, very botched dentistry from other countries. And I'm not isolating one country or anything, I'm just saying in general. I mean, too often I'll see people go to another country and get this really cheap dentistry done, and they'll really brag about it, be so happy with it. And they'll come in, for example, with all these crowns on all their teeth, but the way that these crowns were prepped, so much of that tooth structure was removed so that all these crowns are on these little nubs on these teeth. And then what happens after a year or two is a lot of these crowns start to fail, and then they end up losing a lot of these teeth. And sometimes it even happens sooner than a year. And it's really sad to see, because just because they spent a lot less money on all this work than if they were to just do it in America, they still spent quite a bit of money. And not only that, all that work failed so quickly. And what's even worse is you can't even save it anymore, because so much of that tooth structure was removed, so that now they just have no other choice but to get dentures. So I know this could be an extreme example. I'm not saying this is going to happen to you if you try to get work done in a different country, but I will say just please be careful. Now, if you're in a situation where you're told you need a dental crown and you just want some guidance or something, there are some specific questions you could ask your dentist which might help in your situation. You could ask, why would I need a crown instead of a filling in this specific case? Or you could even ask, what would happen if I don't get a crown? These might seem like really basic questions, but it will really help engage with your dentist and kind of get an idea of what's exactly going on in your mouth. And it might also point out the urgency of this crown. If your dentist is like, well, it's not super urgent, you might be able to hold off a little bit, then yeah, then you can get a second opinion, then you might be able to wait on it a little bit. But if they say that it's really urgent and your tooth could break or something like this, then again, you can still get a second opinion, but you might not want to wait so long on it. Some warning signs to look out for are if your dentist isn't able to show you any pictures or x-rays. Nowadays, we have so much technology where we can literally just take a picture of your tooth, take an x-ray, and show the patient exactly what's going on with the tooth. If they're not able to show you any visible damage on x-rays or any photos or anything like that, that's a clear red flag. All in all, I would say go to someone that you trust and make sure you have a good rapport with your dentist. If you feel like you've been going to this same person for so many years and you trust them, then that's a great sign. If they tell you that you all of a sudden need one crown, but they've been talking about this tooth for many years or something like that, then it really shouldn't be a surprise. Or if you go to someone and they take a picture and they show you like a clear crack in your tooth, then again, this shouldn't be a big surprise to you. I will say though that every case is unique. So there might be some other options in your case where you can avoid getting a crown. It all really comes down to what you and your dentist decide is best for you. But again, if you need one, I wouldn't wait too long to get one, because you don't want to risk potentially having your tooth break or potentially losing your tooth or requiring more expensive treatment to fix that tooth just because you waited too long. So anyways, thank you guys for watching. I hope you liked that video, and if you haven't already, hit that thumbs up button and subscribe to my channel below. I will see you in the next video. Did you know that intermittent fasting could be affecting more than just your weight? Surprisingly, intermittent fasting can play a big role in your oral health. So in this video, I'm going to talk about how it affects a few specific things: your teeth, potentially any cavities, any gum disease, and also your breath. So intermittent fasting is also called time